Kick it out.
Just press record.
It's recording. Oh, yeah, sorry.
Get in there. Do you want a sign?
Snack.
What channel? Channel. Over here. Over here.
So, that we look great.
Yeah.
Sorry, it looks like it's different. Like a real good.
Gonna do a little.
Hello, thank you all for coming out today to show your support for Unity staff and for their patients. My name is George Kerr, and I'm an organizer and representative with the Union of American Physicians and Dentists, representing over 140 members at Unity Health Clinic. I'm joined today by the nurses, SEIU 1199, members from our support staff as well, and patient advocates. We're here today to talk about the working conditions that our colleagues have faced over the past year, from our providers to the support staff to the nurses have all unionized, pointing to mismanagement on Unity's part. This shows that there's deep need for change at Unity, and that's what all of us have done by unionizing, is that we need more of a say in our workplace so we can provide the care that DC knows. We care for DC's most vulnerable, and we love our jobs, and we want to continue to do that. And we need to fight for a fair contract. Today, you'll be hearing from providers, organizers, and community leaders as well about how we can fight to make this situation better. The first is I'm going to bring up Dr. Sugarman, a primary care provider at Upper Cardozo.
Okay, good afternoon, and thank you for coming out on this chilly day. My name is Dr. Kate Sugarman. I've been a primary care doctor at Unity Healthcare since 2010. We are all here because we care about our patients. We care about providing high quality health care to people who are poor, people who are underinsured, people who are underserved, and people who have complex medical and psychological needs. We are not here because we are slacking off, but management accuses us of slacking off, and they schedule us a punishing, unsafe schedule of more and more patients. The result is that many doctors and medical providers have quit. As a result of mismanagement, there are now approximately 40,000 patients who no longer have a medical provider, who no longer have a doctor, who no longer have a nurse practitioner. How does management respond? They hire expensive lawyers to tell us that we should have an even more punishing, unsafe schedule. As a result, more providers quit. But we're not quitting. We are here because we care about our patients and we care about the health of DC and of our community. And we know from this week, we know from Free DC, and we know from the tireless activists that in DC, do we know how to fight in DC? Yes! And when we fight, we win. When we fight, we win. And we will win. Si se puede. Yes, we can.
Yes, we can.
And we will fight until we win.
Thank you, Dr. Sugarman. Now I have another provider I'd like to introduce. It is Dr. Zucker. She's a provider at East of the River.
Hi, everybody. My name's Emily. I'm a family doctor at Unity's East of the River Clinic in Ward 7. I've been at Unity for almost 7 years, and I'm a proud member of the union bargaining team. In the last year, between 2023 and 2024, almost half of primary care providers have left Unity due to the punishing and really unsafe, impossible conditions that we are working in. We have told management in every way that we can, by quitting, by unionizing, by voicing our demands, that we cannot continue to work the way that we're working. And their response is actually to suggest that we see more patients, that we work faster, and that we have even less support. they have not been negotiating with us and agreeing that we need to have better continuity where medical providers see their same patients, and that we need more time for our patients who have complex medical and social issues. We are all here because we are social justice minded individuals, and we are trying to help the people of our communities where we live, and we are not given the conditions where we can do a good job. And we are all here because we want to do a good job and to help people. And when you feel that you can't do that, that's why half of the providers have left. We are just really hoping that Unity will meet us at the bargaining table, listen to our concerns, take them seriously, understand that we are the ones who are doing this work every day, so we know what is possible. And like Kate said, no one is trying to slack off and have an easy job. That's not why anybody works at Unity. And we're really just trying to do the best for our patients. So thank you for coming out to support us.
Thank you, Dr. Zucker. We've got one more colleague from Unity. His name is James Tracy.
All right. Call me Jimmy. Here you go. Thank you, Jackson. Yeah. He's great. All right. Thank you all for coming out. I think Drs. Sugarman and Zucker put it perfectly. I've been a nurse practitioner at Unity for 12 years. I love seeing patients. I love taking care of Washingtonians. I don't want to leave my job. I used to work full time. I had to cut back because the job is impossible to do full time. It just is. And luckily, I have the privilege. I can cut back and still survive, thanks to my wife. But the thing is that it just goes to show you that people who are committed, like me, we want to see patients. We want to work as much as possible and take care of people. But it's just it's plain and simple, unsustainable, unrealistic, unfeasible, the working conditions. So I just want to say thanks to everybody for coming out, and for all of the people, the wonderful providers here. This is an all-star team of just incredible people who have been committed to the patients of Unity for so long. And I just want to say that my hope is that we can get a fair contract, and that working full-time at Unity for years and years and years is a job that can be done, and it's we can fulfill our calling, because right now the conditions are not feasible, and we have a calling and we want to do this. And the continuity, the primary care, it's so important to know your provider, and I think it's so important that this is the kind of job where you can work, see the patients, see them for years, take care of them, watch them grow up if you're a kid, or take care of people as they age, and they know you, they trust you. I mean, this is so important nowadays, more than ever, really. And so we can't be just churning through providers like left and right. We have to set the conditions so that all these wonderful providers can continue to work here, whether they've been here for 15 years or some of the wonderful new providers who are joining us today too. This is the goal. It's to be, and so I just want to say that there's a lot of love here. We love our patients. We love each other. We love the mission of Unity. We want it to work. And so thank you all for coming. Thank you so much.
Our next speaker is going to be the nurses organizer.
Thank you, everybody. I'm Danny with 1199 SCIU, representing the nurses who are unionizing also here at Unity, and we're standing in solidarity because obviously nurses work right alongside the providers. We all have the same interests, all want to provide quality care to patients and the community that is using Unity services. I've been working in the area, part of the community for many years now. Know that a lot of patients are folks that can't get care at other places, and they do rely on these services. So knowing that the community, these patients deserve better. They deserve more time with their doctors. They deserve nurses getting higher pay. They deserve their providers being able to provide the quality care that they really truly deserve and can't get elsewhere. So we definitely stand in solidarity and support you all.
Our next set of speakers are going to be community leaders from the area, and I'd like to start with the speaker from 3DC, Alex Steck.
Thank you. What's up, Unity? I want to start by saying thank you, healthcare workers. The work that healthcare workers do is so demanding and so important. The work that you all put in every day for patients on behalf of our communities, thank you. We know that it is hard work, it is complex work, and it is work that requires so much care at the same time. And we're so grateful to all of you for the work that you do every day. My name is Alex Dodds. I'm one of the co-founders of Free DC. We are a movement to protect home rule for DC in this political moment. And we're here to be in solidarity with our Unity healthcare workers and all of our unionized healthcare industries who are providing care for DC communities. This is a moment we are living through that calls not only for individual action, but for collective action. We are seeing that in so many ways, in so many movements right now, and we saw it this week. Free DC has been in the Senate all week calling on Congress to stop the funding cuts to Medicare, Medicaid, and all kinds of vital programs and public funding that we need for our communities. We have been fighting in particular for DC, which we know is a critically important community for us here as the folks, as the people of the District of Columbia. But we also know that the fight that's happening right now is affecting communities and healthcare workers all across the country. And we know that the work that you all do is vitally important, and we continue to fight for the funding that our communities need for healthcare. One of the things that Free DC really believes in is organizing. And we know that as we think about what this political moment calls for, we know that the work that healthcare workers does is particularly supportive for. That's right, so thank you, healthcare workers!
Read the sign!
Healthcare is one of the pillars that keeps our communities running. It is a pillar that our communities cannot run without. And for the people who are in power right now, who are thinking that they can get away with taking away our rights, taking away our funding, and that we have no recourse, I say that they are wrong. Because the people have power. And one of the powers that we have is the work that you all do every day. It is caring for one another. It is keeping our communities healthy. And so I call on all of you and the Unity management to recognize the hard work that you put in and the dignity and the worth that it has and the value that it has, because no leader who is in power can care for people the way that doctors and healthcare workers do. No leader who is in power can function and take away our rights without the participation of our healthcare industries that keep our communities running. And so I want you all to know that we are in solidarity with you, and we recognize the power that you all have in our communities, and thank you for all you do, and we support you in your fight as you continue. Thank you.
When we fight, when we fight, when we fight, thank you. Thank you all for coming out today. This means a lot to see the support here. I would ask that the community that's come out, scan that link for us to get in contact. We're going to be continuing to have town halls to bring awareness to this, and we just appreciate all the love and support. We care for DC. Who cares for us?
Yeah, that's right.
Look at Terry.
Hi, Terry. Thanks for coming. So I check. Here I go. Oh, kill the tape.